Hi, everyone. Thank you for joining us today. My name is Bree Flanagan. I'm one of the public health educators here at Caldwell County. Today I'm hosting with Tyler. He's also one of our health educators, and we are going to be interviewing April and Emily about the women's health program that we have at Caldwell County. So thank you for joining us, April and Emily. Do you want to introduce yourselves, and then we'll jump into the questions?
Sure. I'm Emily. I'm a social worker in the maternity department at the Caldwell County Health Department.
And I'm April Hilary. I'm one of the maternal health nurses in the maternity clinic at the Caldwell County Health Department.
Thank you guys so much for joining us today to answer some questions. My first question is, what programs does Women's Health offer from our health department?
So we offer a variety of programs for women of all ages. For women of childbearing age, we offer our family planning program, which focuses on, offers birth control options and also like cancer screening prevention with Pap smears once someone's of age to get Pap smears. For women over 50, we have our BSET program, which is the breast and cervical cancer control program. For the women over 50, and then for, of course, we have our maternity clinic for pregnant clients, and we also do adult health. So we have adult health sick visits, adult health physicals, and then also STD testing and treatment if needed.
Very nice. Could you tell us a little bit about the maternity health department?
Yes, we see patients from the beginning of their pregnancy. We start with a pregnancy test to kind of establish care with us as a patient, and we can see people all the way up to 28 weeks. We see uninsured, underinsured, Medicaid, and insured as well. And then if people do not have insurance or they're underinsured, we do see people based on sliding fee scale, which is based on income.
Very nice.
That's awesome. Sounds like there's a lot of services that are offered. So how would a woman who thinks she's pregnant go about making an appointment?
Okay, so if you are of childbearing age and you think you're pregnant, the first thing you would do would be to call our maternity health clinic. The number for that is 828-426-8488, and you'll get Isabel or me. I usually fill in for Isabel sometimes. We're open Monday through Friday, 8 to 5. We also have bilingual staff, so if they are Spanish speaking, it'll be easy for them to get an appointment as well.
That's awesome.
And we make sure it's like a first come, first serve, so whatever we have available, that's what you'll get.
That's awesome.
Very nice. Sounds nice and easy.
Yeah.
All right. How long can pregnant women receive these services from the health department?
So from the health department, unfortunately, they don't give birth in Caldwell County anymore, so we keep them from 28 to 30 weeks. At that point, we'll refer them out to either Burke County or Catawba County, and it's up to the patient where they want to go. We have like a list of the different offices. We just refer all of their medical records that they have with us to wherever they want to go.
Okay. So you did mention that there are some tests that you offer. What kind of tests do we have at the health department?
So for our maternity clinic, we do all the same standard testing that private OB offices do, which is typically what's recommended by ACOG. We go by their guidelines. It's things like the mother's blood type. We do screening to make sure there's not incompatibility between the mother's blood type and the baby's, or that she's not making antibodies against the baby's blood type. We do tests for all kinds of infection, like we do a urine culture to check for any hidden bacteria in the urine. We do hepatitis B and C testing, chlamydia, gonorrhea, HIV, syphilis, just the whole panel of those tests as well. We also, if they haven't had their immunizations, we do titers for varicella and rubella just to make sure that they're immune to those. We do testing for gestational diabetes, usually around 24 weeks, and then we do genetic testing for the mother and for the baby. At every visit, we monitor weight, track their weight, make sure they're not gaining too much too fast or not enough. We monitor blood pressure. And then we check like the urine every time for protein or glucose to try to help catch things like preeclampsia early on.
That's great.
Lots of services there. Plenty to come and see you about. So when it comes to things like Medicaid and the WIC program, what is the process of applying to those services, just so people have an idea?
So for Medicaid, we do an application. It's called PE Medicaid, and it's literally just preliminary Medicaid. You get it for 2 months. We ask about their income. We fill out all the paperwork using the income guidelines that DSS uses. Then send it to social services in the county that they live in. For example, if they don't live in Caldwell County and they live in another county, we would just send it to their Department of Social Services in that county. For WIC, we would either walk them up to WIC because it's in the same building as the health department, and help them make an appointment. Sometimes if they're very young or bilingual, sometimes they kind of want you to stay with them. Or we do a referral for them, and then they can make their own appointment on their own time.
So my next question is, do you offer ultrasounds at the health department?
We do. We typically do their initial ultrasound early, around 8 weeks. We do that to confirm dates, to see exactly how far along they are, and also just to ensure that the pregnancy is in the uterus where it should be. And then they get typically another ultrasound around 20 weeks for the anatomy, to check just all the anatomy of the baby, make sure everything is developing well. And then also at that point, if they want to know gender, they can do that at the 20-week ultrasound. But we also have the genetic testing that can be done after 11 weeks, so they can do gender with that as well. But they typically get 2 ultrasounds.
Okay, good to know.
Very nice. So we've talked a little bit about the services that you guys offer and whatnot. Can you talk to us about, are there any current health concerns that you're aware of that maybe people need to know about, like mothers, expectant mothers, anything like that?
Yeah, so there's a few that we see most often. One of the concerning ones, of course, is syphilis. There has been an increase in congenital syphilis, which can lead to serious complications with the baby. Things like blindness, deafness, deformity in their bones and teeth, and even death. The North Carolina numbers are the highest they've been in almost 20 years. And there was a 24% increase in cases from 2023 to 2024. 2025 data hasn't been out yet, but that is concerning. So that's why we really emphasize how important prenatal care is, and consistent prenatal care. We do test for syphilis initially at the beginning of pregnancy, and then again at 28 weeks. I think there were 6 babies that had died from syphilis in 2024. So that's 6 deaths that were completely, preventable and treatable with the right testing and treatment. We also see a lot of substance use in pregnancy and a lot of mental health as well. With the substance use, we do have a really good partnership with Restart, which is a really great service that we have in the community. They have amazing staff, and I think one of the great things about them is that they have peer support specialists. And I think the special thing about that is it's people who have lived experience with addiction, and they're on the other side of recovery. And so I think that gives patients hope that recovery is possible. So I think that's a really good thing that we have. And then the mental health, I think Emily's going to touch a little bit more on that, but that's anxiety and depression. We do screenings each trimester for that and try to keep a close eye on that. But those are the main 3 that we see.
Yeah. That's great. It sounds like there's a lot of support options for people who may need it, and that makes a big difference, I think.
It does.
Yeah. So that leads to my last question. What other programs do you offer for pregnant women, and can you tell us a little bit more about your CMHRP program?
Okay. So the programs, a lot of things that I do it's called SimHARP and CMARC. SimHARP, it just stands for Care Management for High-Risk Pregnancies. Currently at Caldwell County, we have 2 social workers and a nurse in that program. So we pretty much work with the girls who have a high-risk pregnancies. And that means that can be gestational diabetes, hypertension, seizure disorders, any kind of health concern that they have. we kind of follow them along and make sure that, they're making it to any kind of specialist appointments that they might have. The added resource for them while they are pregnant. It can involve substance use and mental health disorders. I tell a lot of my girls we're kind of like the middleman. So I'm going to help connect them to programs that we have here in the community for their mental health. So that's something I do. We also have a lot of younger clients that are considered teen pregnancies, and they might not have as much support as some of our older clients. So, of course, I kind of am a big support for them. They're nervous at the doctor. They've not been to an OB as often as, our older clients, of course. We make sure that we're advocating for them. Substance use is unfortunately a big issue in Caldwell County. We make sure that they're linked up with Restart. If they're not comfortable with Restart, there are other places that I can refer them to. If it becomes an issue into their postpartum, I, of course, would help them in the CMART program as well, which helps with the baby and the mom as well. Unfortunately, in Caldwell County housing, there is a big wait list along with other counties.
Yeah.
So I can, of course, help them get on the list, or if they have the means, help them complete those applications for housing. We get them help with Medicaid benefits that they may not be aware of. A lot of the Medicaids, they help out with car seats when they're pregnant. They help out with diapers and wipes. They help out with mental health services. The big mental health services that we have in Caldwell County are RHA, Jonas Hill. Those are the big ones. Usually those are the ones our girls know about. So that's kind of where we're referring them out. But of course there's other ones that we can do that referral process also.
Well, that's great. I did have one more question. You did talk about some of the mental health services that are offered outside of Caldwell County. Are there any other programs or services outside of the health department, in addition to the mental health services that might be beneficial for pregnant women?
We have a list of community resources. Honestly, we have a pretty good relationship. There's a lot of great resources in our county. We work with the Oakville a lot.
Yeah.
Catholic Charities has helped a lot, I think, too, with diapers sometimes, and wipes, and even clothes.
United Way.
Yeah. Caldwell Pregnancy Care Center is a really great partnership as well. They've gone above and beyond for several of our patients. And then I think mental health wise, we do have a list of like counseling resources, and most of them do work with Medicaid and take Medicaid, so that's a good thing too.
Yeah. I know we also have, if they're Spanish speaking or they don't have insurance, we can help them kind of get to a dental clinic that can help them on a sliding scale fee. Also, we see that some with our Hispanic clients. So we can help them with that.
That's awesome. And one more thing I did want to mention. You were talking about help with diapers and things like that. We do also have the Safe Kids program. So if anybody here needs a car seat or things of that nature, reach out to us and we'll see if we can help you all out. I think that was all the questions I had. Tyler, did you have any other questions?
I don't think I had anything else prepared. I don't want to go off too off script here, so I just want to make sure that you guys have covered everything you think you needed to.
Yeah.
Yeah.
We just want to make sure that women know, because I know a lot of people know now we don't have a delivering hospital, but you still can get prenatal care here in Caldwell County, and a lot of our clients have transportation issues and things like that, so we just want to get the word out there that we're still here, and we'd love for you to come see us.
Yep. Got a good group of ladies.
Yes.
Plenty of services for sure. All right. And once again, the number that you can reach them at is going to be 828-426-8488. So if you need any help with getting set up, you can give them a call.
All right. Thanks, guys. Bye.
Bye.